morning. I'm here to share my perspectives on the likely impact on generic pharma of coronavirus. My name is Parijat Ghosh, and I'm a partner in the Delhi office of Bain Company. It is very clear that we are in the middle of a once-in-a-century crisis that has spread across the world in a matter of months. This is not just a health or an economic crisis. It has already affected multiple aspects of human life as we know it. Companies have moved swiftly to a crisis mindset, managing people implications, protecting the business, and trying to be a part of the solution for their community, for their countries, and for the world. At the same time, standard crisis management playbooks are likely to be insufficient in addressing the implications of this change. The healthcare ecosystem could evolve in a few different directions at a very rapid pace, and we are already seeing evidence of that. Decisions that used to take months and years are being accelerated, whether regulatory changes or companies getting into new areas. Organizations will need to stay ahead of these changes and use this opportunity to exit the disruption with the plan and the building blocks to become true leaders. Two critical uncertainties frame the potential bookend scenarios of the current crisis. The first is the depth and the duration of the COVID-19 disruption. Will we return to normal activity levels in 3 to 5 months, or is this a protracted 12 to 18-month pandemic? The second is whether there is going to be bold and effective actions by stakeholders to mitigate the crisis, or whether we will see uncoordinated or ineffective actions. In a favorable bookend scenario of new hope, we could see a short, sharp contraction followed by a rapid recovery of economic activity. The behavior of retail stakeholders, doctors, patients, channel participants will change significantly even in this scenario, catalyzed by the disruption and sustained by ecosystem actions. Imagine rapid uptakes in telemedicine, digital health, along with enlightened regulatory actions, openness, and new funding. There is also increased healthcare innovation with a focus on acquisition of new capabilities. At a minimum, we will see a higher risk sensitivity, leading to increased focus on the resilience of today's global and geographically vulnerable value chains. At the other end of the spectrum is balkanization, a prolonged economic disruption and associated public health crisis with health systems struggling to respond effectively. One can imagine that a national interest view to healthcare will become a key policy lever with measures like profit and pricing caps, soft or hard nationalization, and or government mandates to secure supply and state-directed innovation. We could also see forms of deglobalization as markets take a national security view of healthcare. Multiple stakeholders will be forced to take a survival approach that will further hamper recovery. In this environment, we think that management teams need to consider 3 actions. 1, they need to understand and align on the different scenarios, including their planning scenario between these 2 different bookends. They need to consider a portfolio of no-regret actions, options that they could consider, and really moonshot actions to strengthen their strategic position. Last, they need to identify indicators and trigger points to track and stay ahead of the evolving crisis. Take care and stay safe.